What would you say is the cost in terms of, in human terms, of teenage pregnancies? Now, we've talked about the breakdown of the families and et cetera, but looking at people who are involved from an individual point of view and from the point of view of their lives, what would be the cost of that?
It's enormous. Not only is the financial cost a big burden on families, on teenage parents, but it's also the cost of just in terms of health factors to the mother and to the child. So often, young women, especially teenagers who are pregnant, they tend not to go for early prenatal care. They put themselves and their child at an early risk. Not only that, but it disrupts their school education. 45,000 teenagers drop out of school every year because of pregnancy. And when you stop to think about trying to get a job, trying to support your children, trying to support your family, it's almost impossible to do. And it's not to say that young women don't do it, because they do every day. But it makes their lives a whole lot more difficult. And in terms of just the cost of financial, health, emotional cost, teenage pregnancy just takes a toll on the family. Black families who have been known to be extended families, which is one of the biggest support systems, has lost a lot of that support now because they don't have that extended family.
We're going to have to take a break now, and we're going to come back and talk about some of these issues during the final segment of our program.
Are you looking for a wild and wonderful afternoon?
Oh, I can provide that.
Then tune in to Z17 at noon when Robert Conrad is a daring and dashing secret agent, James West.
And at any moment it could mean sudden death.
Then at 1, Linda Carter stars as Wonder Woman.
To work and fight for justice, democracy.
For a wild and wonderful afternoon, join us weekdays beginning at noon only on Z17.
Did your doctor say that drug was safe for your baby? While you're pregnant, don't take drugs unless they're prescribed by your doctor, who knows you are or may be pregnant.
Mommy, don't.
The topic is teens in trouble, and we're talking to Mr. Wingfield and Ms. McCord. Before we had our break, we were talking about prenatal care and some of the problems that some of the young mothers have in terms of prenatal care. But also, Mr. Wingfield, you suggested that there is some connection between prenatal care as perceived by her organization and prenatal care as perceived by your organization. Could perhaps you expound upon that?
There's a definite connection. I think minority families, and especially teenagers who hide their pregnancy, at least for the first, until they begin to show anyway, don't take care of themselves. A lot of times these children do not get what it takes to develop properly in the fetal state. Sometimes they come out borderline retarded or slow. And if they're not able to compete well in school, they become a problem in school. And then when they drop out of school because they can't compete well there, then they wind up in the court system for one reason or another.
So in other words, we can almost trace some of the problems that you face as a probation officer back to some of the problems that you're dealing with, Ms. McCord, as a person dealing with teenage pregnancies. Now, what are some of the services offered by the Crittenden Center, Ms. McCord?
Well, Crittenden has a broad-based different kinds of programs. We have school counselors who work in all of the metro high schools and junior high schools to work with pregnant teenagers and to do some part of prevention. We also have a CAT panel, which is for young women who are have had pregnancies or one who's a non-sexually active teen. And they do a lot of prevention in terms of talking to groups of adolescents about their experiences. We have the Teen Tapestry, which I had spoken of earlier, and that is a collaboration of 10 agencies such as Planned Parenthood and the Harry and Project Pencil. And we try to take a comprehensive look at teenagers and their problems as well as trying to deal with their family. And that's located in North Nashville, and we'll be serving just that specific area. But we have a lot of different ways that we try to work with teenagers and to provide our services to them so that they know that we're out there and that we care and that there is some place for them to come.
Well, do you think that we're winning the battle against teen pregnancies, Ms. McCord?
Well, overall, in terms of black teenagers, the number has kind of come to a halt, but it still outnumbers the white teenagers who were pregnant. So we still have a long, long way to go, and there isn't one solution that's going to make this an okay problem.
Well, what do you think about Dr. Jackson's solution in terms of a moral reformation within our community?
I think it's going to take that, and I think it's going to take a lot of parents being able to talk to their children. So often we don't have the kind of support systems that parents need to help them talk to their kids. And I think it's going to take lots of innovative ideas to help deal with that problem.
Very good. What would you suggest as a method of dealing with the questions of youngsters in the juvenile court system, Mr. Wingfield?
Well, because of the time, let me just kind of get you to the bottom line on this situation. I don't think that our judge or referees or any of the people at juvenile court would argue the situation. We have a definite problem that's getting worse with our young people in this country. And the bottom line of it is, how much money are we willing to spend to develop our natural resources? Our funding comes from Metro Council. Okay, our councilmen support us and give us our budget. The court operates underneath the laws of the Tennessee State Legislature, Tennessee Code Annotated and Metro laws. These are the people who determine exactly how we will operate, what kind of policies we will institute as far as the children are concerned. Our judge, our people at the court, everyone in this country, as a matter of fact, operates under rules and regulations. Okay, the things that we do with young people have to be within the guidelines set forth by our legislature and by Metro.
We're sorry that we're going to have to cut off at this point, Mr. Wingfield, but we want to thank not only the two of you, but also Dr. Jackson for coming by and shedding additional light on this whole question of teens in trouble. And we'd like to invite you to tune in next week for another interesting topic dealing with the Black Pulse of Nashville. Thank you and good night.